There's been a lot of buzz this year around shared decision making. What does it mean? How do we know it works? Well, I have with me now David Wenenberg and also Elise Burns, both of the company Health Dialogue. Great to see you both.
Thank you.
Nice to see you.
Well, do you want to take that one first?
Sure.
Dr. Wenenberg?
Softballs, I always like softballs. Okay. Shared decision making is actually a concept in which there's an explicit incorporation of patients' preferences and values in the process of selection of treatment options. And it's focused primarily on areas where there are treatment choices. For example, patients with open heart with a chronic stable angina, where you could have angioplasty, surgery, or medical management, all evidence-based, but all have different risk-benefit ratios. And the key concept here is how do you get patients to understand both the risks and the benefits of the treatment options? How do you explore their preferences and values for both of those, for the risk and benefits? And then how do you marry the two, preferences and values, with a choice? And it's a certified process that works well, and it's been tested in numerous settings.
Okay, now Elise, it sounds like this isn't something that healthcare professionals only know about. Consumers should be educated in this as well.
And there was quite a lot of buzz and excitement during the drafting of the Affordable Care Act around shared decision making. It really started taking off about 2 years ago. And the concept is not mandated, but there are two provisions that we worked on and are very excited about that have been included in the legislation. The first one includes a new model of payment under the Innovation Center that is created within the Center for Medicare and Medicaid Services. And the second provision is actually a program to facilitate shared decision making. It's a grant program, so it's not funded right now, but we hope it could be. It's a grant program to produce, update, distribute aids to providers and to the public, and providing grants to physicians to implement shared decision making, as well as create a new certification process for the decision aids.
Well, how can we be sure that this system works?
Yeah. So I think, Mabel, that's an important question. And in a lot of these things, when there's new ideas, the question is how do you figure out whether they actually deliver patient value or on that side. And I think what's really interesting about the concept of shared decision making is there actually have been more randomized trials of shared decision making than there are of the underlying surgical interventions, which we think of as common places in the delivery of care. So, for example, there actually are trials that look at the use of shared decision making for patients considering surgery of the back. There's trials of hip arthritis, and these trials have actually shown that patients understand, can participate, and that they systematically choose differently if they are incorporated in shared decision making than they do if it's unusual care. And we've actually did a really large randomized trial that was published in the New England Journal in September, in which one of the key components of the delivery was this concept of incorporating shared decision making in the process.
Elise, do you have anything to add to that? Or what, any other aspect that we haven't covered?
There's still a lot of buzz at CMS, at the Center for Medicare, about this new pilot. And we're working closely with the Innovation Center staff and hope that we could see a pilot within the Medicare program that would be very beneficial to Medicare patients.
By when do you think?
I would say within the next 2 years.
I think the other part, Mabel, that you asked about the consumer side, the other part that we were really excited about is the Accountable Care Organization regulations just were released. And actually one of the pillars of patient-centeredness, with the part of the AAA, the patient-centered aspect, actually was shared decision-making. And so Don Berwick, who's the administrator, actually has been very vocal in his support of shared decision-making, as have many of the other many other organizations. And to see it actually come through in the regulations, or at least on the first draft of the regulations, for us it was really great. And particularly to see it part of the patient experience, because it really does call out the importance of the consumer as part of this effort.
Okay. David Wenenberg, Elise Burns, thank you.
Thank you.
Thank you.
And I'm Mabel Jong. Thanks for watching.